The spinal cord is the most important part of our body. It is a thick bundle of nerve fibers that allows our brain to communicate with other peripheral nerves that branch out everywhere else in the body. The spinal cord connects to the body's spinal nerves, and any injury to it affects the lanes in this expressway. Any kind of damage to the spinal cord not only affects the mobility of a person but also impacts the overall well being. It may also lead to loss of essential functions like an autonomic processes. A spinal cord injury, SCI, is caused by a trauma that impacts the spinal cord, causing various symptoms like tumors, degenerative and vascular conditions, infections, toxins, or birth defects. It can also result in a long term disability. Every year, the month of August marks Spinal Muscular Atrophy Awareness Month. It aims to increase understanding and support for people affected by the condition. Spinal muscular atrophy, SMA, is a rare genetic disorder that causes progressive muscle weakness and loss of movement. It affects roughly 1 in every 10,000 children born every year and is caused by a mutation in the SMN1 gene, which leads to a shortage of crucial motor neuron proteins. It is also observed that SMA primarily affects children. There is no cure for SMA, but certain therapies and medications can help manage symptoms. But first, we need to understand the symptoms of this rare condition. The most common symptoms of SMA are weakening of muscles, especially in the arms, legs, and trunk. They can even lack the basic strength for normal movement. The affected children or adults can be seen struggling with daily activities, including to sit up, crawl, walk, or stand due to reduced muscle control. As the muscles around the chest and throat weaken, it makes it hard for the affected person to breathe deeply or swallow safely. There is a noticeable and involuntary twitch or shake in the muscle fibers. As the weak back muscles are unable to hold the bones, the spine of a person suffering from spinal muscular atrophy may bend abnormally, causing joint problems. Not being in use, the muscles visibly shrink and become thinner. As science is advancing, several treatments are offering new hope in the cure for various spinal cord injuries. Effective prevention, treatment, rehabilitation, and ongoing healthcare are essential to alleviate the global burden of SCI. There are multiple options available for treatment of the spinal cord injury. They include spinal deformity surgery, a treatment for conditions like spinal stenosis and fractures. Another option available is minimally invasive spine surgery, which is a specialization offered by several hospitals to provide less invasive surgical options. There are also traditional methods like the spinal fusion discectomy and laminectomy that are effective in herniated discs, spinal stenosis, and fractures. A cell therapy is regenerative medicine approach that uses stem cells to promote nerve growth and functional recovery after spinal cord injury. One must also opt for rehabilitation along with the treatment that includes multidisciplinary care with the help of physical therapists, occupational therapists, psychologists, and nurses. The treatment to any spinal cord injury needs long term support through outpatient phases and yearly evaluations to maximize patient function and independence. Recovery is not just physical, it's about emotional resilience and reintegration into society. Rehabilitation plays a key role, often beginning immediately after injury and continuing for years, that helps patients regain independence and quality of life. Whether it's a rare genetic disorder or a traumatic injury, every story matters. Every step forward is a step towards a better future. The message thus is clear. Greater awareness leads to early diagnosis, better care, and stronger support systems, not just for rare diseases like spinal muscular atrophy, but also for life altering conditions like spinal cord injuries. Bureau Report for DD India.